So let's talk about diagnosis of anemia. Now, whenever you get a suspicion that a child has got anemia, or let's say he has got some clinical features which are suggestive of anemia, like for example, pallor, for example, excessive lethargy, tiredness, or let's say for any reason you have done a blood test and you find out that the hemoglobin is low for the normal range for that age group, then in order to further diagnose anemia, remember you have to order iron studies. It's very, very important that you do iron studies. You cannot simply diagnose anemia or iron deficiency on the basis of low hemoglobin. Or sometimes, as a part of the full blood count, they also do a blood film, which would give you some of the features of the RBC morphology. For example, what is the mean corpuscular volume, what is the mean corpuscular hemoglobin concentration, and things like that. I mean, that can help, but you still need to order iron study. So the most important thing to come across if you have seen a child with anemia or clinical features which are suggestive of anemia, or let's say the hemoglobin is down for any reason, remember you want to further work up, to order iron studies. Now, what does iron study contain? Iron study contains your serum iron. It looks at your serum transferrin levels, and it also looks at your iron level, transferrin, and ferritin. So these are the three things: serum, ferritin, serum, transferrin, or sometimes they also use transferrin saturation, and the third thing is serum iron. So these are the three important parameters or parts of iron studies. Now, how do you further interpret these things? So once you have got the result for the serum iron, serum ferritin, serum transferrin or transferrin saturation, the first important thing is that you look at serum ferritin. So the first thing in all these three things that you look at is as what? Serum ferritin. Serum ferritin. Remember, serum ferritin. Serum ferritin is the most sensitive indicator of iron deficiency. You've got low serum ferritin, it confirms iron deficiency. Alone, low serum ferritin confirms your iron deficiency. That means that the child has got iron deficiency anemia. Sometimes he might not be having low hemoglobin. I mean, hemoglobin might be normal because of hemoconcentration or because of various reasons. Because sometimes hemoglobin takes a while to go down, and before hemoglobins go down, the serum ferritin would be already low. So, a low serum ferritin alone, with or without decrease in hemoglobin confirms your iron deficiency. That child has got iron deficiency and would need iron supplementation. And that's another question whether you want to supplement that iron in the form of oral iron, IV iron, or like transfusion in the form of pack cells. That's a different debate. We will take it at some other time. So alone, low ferritin confirms your iron deficiency. Now, at the same time, you have to check serum transferrin or transferrin saturation. Now, let's say if your transferrin is decreased or let's say is normal, then it means that it's purely iron deficiency anemia. It's just iron deficiency anemia. There's no other thing at the same time. But let's say your transferrin is increased. Ferritin is low, but transfer is increased. In transfer is that simply means that you not have only got iron deficiency at that, but there might be some sort of ongoing infection, a low-grade infection going on at the same level. So remember that has to be interpreted with a pinch of salt, that it is iron deficiency, but at the same time some sort of a low-grade infection is also going on. Now, what if you get a normal serum ferritin level? Now, if you got normal serum ferritin level, because there's a catch here, ferritin is also an acute phase reactant. So sometimes even if the child has got iron deficiency, the serum ferritin can come out to be normal. So again, it has to be interpreted very carefully. So if the serum ferritin is normal, you have to look at what? You have to check transferrin and you have to check the serum iron as well. So check transferrin and check serum iron. Why? Because you further want to see whether this is a normal child or he has got some iron deficiency. Because I told you, most sensitive indicator is ferritin, but it's also an acute phase reactant. So if there is some infection going on, acute infection, the ferritin would be normal. So you might be misguided that it hasn't got any iron deficiency. In fact, there is iron deficiency, but because of the acute phase reactant nature of ferritin, it has gone up or is hovering around normal level. So check transferrin and check iron. Let's say if the transferrin and serum iron levels are low, then it means that the child has got anemia, but because of some infection going on, the ferritin levels are hovering around normal. So we call it as anemia of chronic infection if the serum transferrin levels are down, serum iron is down, but ferritin is hovering around the normal levels. Let's say serum ferritin is normal and both transferrin is also normal and serum iron is also normal. Okay, but the child looks like he's got like pallor, probably he's got anemia. Now, what are you looking at? Most probably here, you might be looking at a child who has got thalassemia trait, because thalassemia minor or thalassemia trait kids have got pallor, their hemoglobin is low or on the lower side, but usually if you see their serum ferritin level, their serum iron level and serum transferrin level might be within the normal limits. So the only one thing here which would give you a clue is that hemoglobin is at the lower level of the normal, but the blood cell morphology, like the mean cell volume, mean RBC volume, that would be very low. So let's say if the child is at the lower range of anemia, let's say 100 or 10 gram per deciliter, but the MCV is quite down. I mean, with 10, you won't expect an MCV to go down to 60 or 50, but you see, anemia is not that, like hemoglobin is not that down, but MCVs or, these morphological parameters are too much down, and iron, ferritin, and transferrin is normal, then you're probably dealing with what? A thalassemia trait. And you might see that the RBC count is a bit higher so despite anemia, the RBC count is slightly on the higher side. So normal ferritin, normal transferrin, normal iron, think of thalassemia trait. Or it might be that somebody was anemic basically and he's undergoing treatment, and because of the treatment, the things are like slightly, they're getting settled. So things are coming back to the normal, but still not fully resolved. So always, if that is the case, you ask if he has been diagnosed with anemia and whether he's been undergoing any treatment or not. And if you're thinking of thalassemia trait, especially those people who are coming from the South Asia, the best next thing to do would be to order HB electrophoresis. So you have to send the blood to, so that they do the HB electrophoresis, and they will look at the further components of hemoglobin, but how much of the adult hemoglobin is there, how much of the A2 hemoglobin, and how much of the fetal hemoglobin is there. And based on that, then you can diagnose whether that is thalassemia major or minor. But what if you have got a child who feels like you are suspecting anemia or has got clinical features, or maybe has got like decreased hemoglobin, but when you do the iron studies, you find a high ferritin. Again, keep it in mind, ferritin is an acute phase reactant. So again, the same thing as you would do in normal ferritin, you will check transferrin and serum iron. And if they are increased, you're probably dealing with sideroblastic anemia, because in sideroblastic anemia, all these parameters are high. These are sideroblasts in the blood, and morphology also show that. Again, if you find that there's a high ferritin and the what you call the or serum iron level is on the higher side as well, but the transferrin is on the lower side, you might be dealing with the major form of thalassemia alpha or beta. And in that, again, in that particular case, you have to do HB electrophoresis. So this was a brief about how do you interpret iron studies. So again, just to give you the summary of what we discussed today is that if you are suspecting anemia or you've got clinical features of lethargy, pallor, things like that, you order iron studies which can create you serum iron, serum ferritin, serum transferrin. The first thing to look at that is ferritin, because ferritin is the most sensitive indicator, and alone low ferritin actually confirms your iron deficiency anemia. But if it is normal or high, you have to look at the transferrin and serum iron levels. If with a normal ferritin, they both are down, you probably are dealing with anemia of chronic infection. But if everything is normal, you might be dealing with thalassemia trait, or you might be dealing with a child who is getting treatment for uh, anemia and is possibly going towards the normal side. And if you've got high ferritin, you again check at transferrin and serum iron levels, and alone, if both are them are increased, you're probably dealing with sideroblastic anemia. But if iron is increased but transferrin is decreased, you're probably dealing with thalassemia major. So this is how you interpret iron studies. I hope you have understood that, and if you've liked this video, give me a thumbs up. If you have any other further questions, put it down in the comment section below, okay? I will answer them as soon as I'm available again. Have a very good day. Take care and bye-bye.